What if I told you you could get a pill that would reduce all causes of mortality by 25% for you in the next year? And according to Memorial Sloan Kettering Cancer Center, it can help cancer patients live years longer and with much better years. And on top of that, it will make you stronger, faster, and better at everything you do. What would that pill be worth to you? Dr. Peter Attia said it could be worth $1 million a year if they could take this magic pill and make it into something you could take every day. But you don't have to pay $1 million. In fact, you don't have to pay anything at all. It's exercise. But it's a little more nuanced than that, especially if you have cancer. There's things that you need to consider. You need to do fact versus fiction. So stay tuned. Welcome to Walking on the Edge, Living with Cancer. My name is Lori. I am a national certified personal trainer and health coach. And along with my sister Sherry, who will be here in a second, she is a 6-year stage 4 lung cancer survivor. So like I said, we're going to talk about exercise today, especially as it applies to people that are living with cancer. So whether it's you or a loved one, stay tuned and thanks for showing up. Everyone knows that exercise is important for everybody, but if you have cancer, it's absolutely critical. This groundbreaking study from Memorial Sloan Kettering Cancer Center shows that people with cancer that exercise versus non-exercise live an astounding 5 years longer on the median. That is amazing. But not only that, other research shows that people with prostate cancer, colon cancer, and breast cancer have a much lower incidence of reoccurrence when they exercise. The other thing is that people with cancer, about 1 in 5 doesn't die of cancer. They actually die of muscle wasting. It's you can get a disease that not only wastes your muscle, but causes you not to be able to gain fat, and you just waste away. That's 1 in 5. So what can you do about that? Unfortunately, there's not many treatments. Exercise, especially resistance training, which we'll get into, is one thing that can help you avoid that. But on top of all of that, exercise has so many benefits for you, including helping your brain and body function more efficiently, helps reduce fatigue, reduces depression and anxiety, helps with insomnia, helps improve your physical ability to work and do chores. That's so important. It improves your muscle strength, your bone health, and your range of motion. And it strengthens your immune system. And if you're on chemo, that's so important. And it can help increase your appetite if you're dealing with a loss of appetite. Of course, we know it helps maintain a healthy weight. And it may help with breast cancer-related lymphedema. It can decrease the chance that some types of cancer will come back, helps improve your metabolic function, and reduces treatment side effects. So, Sherry, I know you like to exercise. Remember, Sherry has been dealing with stage 4 lung cancer for 6 years. So, Sherry, what type of exercises do you do? And have you noticed a positive effect of that?
I think it really helps manage the side effects. I notice days that I don't exercise, I definitely don't feel as well. I feel more fatigued. So I definitely try to walk a lot. And in the summertime, I have to go to the gym and exercise on a treadmill or walk indoors, whether it's like to a YouTube or like a video that I have. Summer or wintertime here, I live in Florida, I will walk outside. I do like to do the TRX, which it's a performance tool that leverages your body weight.
Right.
And yeah, it uses gravity to leverage your body weight. So I do like the TRX. It's a little more gentle. I have some back problems, so that helps a lot. I do a little bit of weight training, not as much because I do like the TRX. And then I like the pool, swimming. Swimming is definitely a gentle form of exercise. So yeah, I try to incorporate all of those things.
Well, TRX is considered resistance training or strength training. So you do not have to be the typical going in and squatting, deadlifting, all of that. In fact, I would suggest if you're somebody who has not exercised before your cancer diagnosis, please talk to your doctor, get with a personal trainer or someone before you decide you want to do these insane things like squatting, deadlifting, and that kind of thing. Anything like TRX, kettlebells, even the machines, going and just doing the machines are perfectly fine doing that. So TRX is amazing for that. The American Cancer Society has a physical guideline for cancer survivors. And I'm going to tell you what they say. They say to avoid inactivity and return to normal daily activities as soon as possible after your diagnosis and treatment. Take part in regular physical exercise, which means 150 to 300 minutes of moderate or 75 to 150 minutes of vigorous activity every week. Start slowly and build up over time. Exercise several times a week for at least 10 minutes at a time. Resistance training should be at least 2 days a week, and you should do stretching like yoga. And Sherry and I talked about that in another video about stress and anxiety, which I will link above. But yoga is also an amazing exercise that is proven to have really great benefits for those that are, for everybody, but anyone that's dealing with an incurable disease, very stressful, that is great. And I know, Sherry, you love the yoga too.
Right, and I left that out. I can't believe I left that one out. That's one of my favorite exercises. And I'm lucky enough to be in a yoga class that's actually all cancer patients, and our teacher is wonderful. So she's very great at understanding the needs of people with cancer. So it's been a wonderful class for me.
And if you're not able at the moment to get out, there are online classes specifically for cancer survivors. So that's something that you could easily do. Also, we all have YouTube right at our fingertips, right? You can find anything in the world regarding exercising, especially yoga, meditation, right on YouTube or even on Amazon. I have little videos that I rent from Amazon all the time. So just because you can't go to a yoga studio or to a gym, that doesn't mean in this day and age, especially, that you can't be exercising. Sherry and I, you guys remember who Leslie Sandstrom, is that her name? I can't remember, but she does she's been around for 20, 30 years now doing the inside walking stuff, right? And she's a very sweet lady. And Sherry and I have just pulled out our laptop and did a Leslie Sandstrom's walking to this, walking to that, and you can get a pretty good workout. She does band work, right? Didn't we do one with bands one time?
And weights, like 2 to 3 pound weights, maybe even ankle weights or whatever.
So these are just general guidelines that I gave you. Okay, this is so important that you talk to, before you get started, you really do need to talk to your doctor, the doctors, the nurse. They are going to encourage you to exercise. I can tell you that now, but depending on the type of cancer you have, you may have some limitations. Especially, I want to talk about anybody who has mets to the bone. If you have any problems with your bones, this is something or soft tissue cancer, this is going to be a contraindication for you, meaning that there may be some exercises that you cannot do. I am a personal trainer, but it's outside of my scope of practice to talk to you about exactly what you should be doing unless I can physically meet with you. But these are the things that I know. So please do talk to your cancer specialist about that. They may have you even get into physical therapy before you start a physical exercise, especially if you've not been able to be active. But trust me, they're going to encourage you to be as active as possible.
You can also check with your cancer hospital on, sometimes they do have yoga classes, or they'll know of a yoga teacher that, specializes in people with cancer. So your local cancer hospital can be a great resource.
Yes, well, they may even have yoga classes or different exercise classes. So that's maybe your first place to start, is with your doctor. The American College of Sports Medicine has a program called Moving with Cancer. I will link that in the description. So this is a great place where you can begin your journey. So make sure and check out the description for that.
It's important to know that certain things can affect your ability to exercise during treatment, such as the medication I take. I take a targeted therapy, and that really breaks down my muscles. So my muscles are sore. There's a lot of times where exercising hurts. There are days I can't exercise because my muscles are so sore. So I have to take it easy. Sometimes I just need to hydrate more. I'm so dehydrated from the drug I'm on. And once I'm hydrated, I find that exercising is a lot easier. A lot of times, I know, like, people that are starting out that haven't exercised in a long time. And this actually happened to me. I had gotten COVID, and I was very, very sick, and I lost muscle. And I actually, instead of going right back into the gym, I actually got physical therapy because I was really, really weak and my balance wasn't good. So I got physical therapy, and I know a lot of people that they will get physical therapy before they actually start going into an exercise program at a gym. Another really good resource for cancer patients is the Livestrong program. That starts you out. That is at the Y, and it's specifically for cancer patients, and that starts you out at your pace, what you can handle. And you do have to get clearance from a doctor before you start the Livestrong program. So that's a really great resource for cancer patients.
Oh, okay. Well, we'll link that below too. We'll give you a link. I'm sure that's probably nationwide. I used to work for the YMCA as a trainer, and we didn't have that at that time, but maybe they do now. So we'll link that so that if you're interested in that, you can. One thing that we need to talk about too is, remember, Sherry has stage 4 lung cancer. Years ago, this would have been, she would not be alive today. Okay. Before the treatments she had, these people with her type, it's ALK positive, they would live a year or two because they were just trying to treat them like regular lung cancer. These are mostly people that have never smoked or lightly smoked. It's people of all ages. So doctors now, people are living longer with cancer, every kind of cancer. Now that we're getting the personalized medicine, people are living longer. And so guess what's happening? They are getting heart disease. They're dying of other causes. And now doctors are realizing, wow, we have to take care of the whole body, right? It wasn't so important to exercise if they figured you had 6 months to live. But now that people are living a decade and longer, you will find cancer treatments are extremely harsh on your body, and you may end up with cardiovascular disease, strokes. And so exercise is absolutely critical for people that are taking cancer treatments of any kind, because you are going to live long enough where it is going to start affecting the rest of your body. That is a problem. So exercise is one way to help mitigate that and keep you metabolically healthy. So Sherry, I know that you've even said that with your muscle breakdown, the targeted treatments that she's on will have muscle breakdown. So further breaking down your muscles actually causes problems. So you need to understand that, right? So you would need to actually back off on your exercise, especially resistance training. At that point, you would start small and like take slow walks. And like you said, maybe do some swimming, right?
Right. Yeah, definitely. Yeah.
Yeah. Yeah. And so these are the things that you really need to keep in mind. That's why it's not a cookie cutter thing. This is why we can't tell you, you need to, this is X, Y, Z, and you need to do this. It so depends on where you're at. But worst case, you can always do walking. Walking is the most important thing that humans can do. We're built to walk. That's what we are meant to do. We're supposed to walk. Inactivity is one of the worst things that can happen to you. Once you sit down, and if you sit down long enough, one day you're not going to be able to get up. And I know for most cancer patients. That feeling normal is so important because you don't want to feel like everyone is here and you're out here, right? I know you want to feel normal. And I so understand that because I also have an incurable disease that I don't feel normal. I am tired all the time and it's disfiguring. I have a disfiguring disease. Again, this is something we can talk about some other time because it's not about me today. But I understand about just wanting to feel normal, feel like you fit in. So join a walking group. Like we said, take yoga classes. This is a way that you can feel somewhat normal again and help you get through your treatments. Does that make sense, Sherry?
Oh yeah, definitely for sure. And as far as like keeping your heart healthy, I mean, like you said, we are living longer. And these treatments are harsh. I don't know if you remember years ago when I was in my angry phase, because I had spent my life being so healthy, eating healthy, exercising, and here I got lung cancer and I was angry. And then I went through this phase where I was like, you know what? I'm just going to eat whatever. I'm going to do whatever. I was just mad. And you said, wait a minute. You said, why would you do that? You still need to protect the rest of your body. You know, you need to make sure, you know, the treatment you're on is harsh. Why would you not take care of the rest of your body so your cancer journey, the rest of your treatment, you don't feel like crap. You don't feel terrible.
Yeah, because what's the point of being alive? Here's the other thing is, let's say that you are in the angry phase. Let's say that you're someone like Sherry or like myself, who you've always taken care of yourself. You don't smoke, you don't drink to excess, you try and eat healthy, you exercise, and still you have cancer. Have you ever thought about what would happen if you weren't being healthy, if you weren't doing those things? How do you know that you wouldn't have got cancer 10 years earlier, 20 years earlier? How do you know that? You don't know that. We can't do those kind of clinical studies because how do you take a person and have an unhealthy version and a healthy version? It's always better to err on the side of being healthy. And I understand, Sherry, there's people that you know in your cancer group, and they say, I don't care, I'm going to eat all the ice cream I want, and I don't care, you know, I don't probably have too many more years to live. And there's nothing wrong with that. If you want a bowl of ice cream, if you want that glass of wine, I see no problem with that. But that needs to be just like with other people, the exception, not the rule. That's what I think. That's my theory on that. Okay, so we've hopefully convinced you that you need to exercise because it's going to help you out so much. A couple of things we need to talk about though. If you are somebody that has a port, if you are in chemotherapy, these are things that can cause infection. So if that's the case, you do want to stay out of public pools. You do need to be very cautious about going to a gym, especially if you're especially if we're like in a COVID outbreak or a flu outbreak. Please be cautious about that. Stay away if you're having problems with your balance, because I know chemotherapy can also cause you to be unbalanced. Please exercise in well-lit places. Please stay on an even surface. So these are some of the things that you need to look out for. If you feel severely fatigued, you may want to think about getting with palliative care. They can help you. Now, this is not, I'm not a doctor. I know that they're with the severe fatigue. I've heard of people that are getting on Ritalin and other things to help with their fatigue. Have you heard that, Sherry?
I was actually taking it for a while, but I didn't respond very well to it. I mean, I ended up with some side effects, so I had to stop. It just didn't work well. But yeah, palliative care is a very great resource for fatigue and muscle aches, a lot of different problems. They can be here, the hospital I go to, that's called supportive care. So it might fall under a different name at your hospital, but yeah, they're definitely a great resource to help with side effects.
And so, like we said, drink plenty, eat healthy as you can. You need to talk to somebody who is an expert in cancer, like a dietitian who's an expert in cancer care. Some people will need a higher protein diet. Some will need a lower protein diet. It depends on your kidney function. It's going to depend on the kind of exercise you do. So I am not going to give you any recommendations on what your exact diet needs to be, but you can talk to somebody, and that's really important if you're doing especially resistance training. Any kind of resistance training, like Sherry was talking about the TRX, the weights, even calisthenics, they will require a higher protein intake so that you can build muscle. You can't build muscle off carbohydrates and fats. It doesn't work that way. You actually have to have protein, whether it's plant-based or whether it's animal-based. You will need a certain amount of protein. But if I were someone that had cancer and I had compromised kidney function, if I had severe fatigue, these kind of things, I would talk to a dietitian first and see what they thought, especially, and I'd keep a tab on my labs too and see. And you would need to tell them what kind of exercise you're doing. If you're doing just walking, swimming, yoga, you probably can have that protein level a little lower. So what's your diet like, Sherry? When you exercise, do you kind of work around what your exercise is, or is it just the same all the time?
No, I increase my protein. I like the powdered protein shakes after I exercise. Those tend to give me more protein. It's quicker, it's easier. Yeah, I use those.
One thing I wanted to mention, if you have a catheter in, watch when you're doing lifting weights, if you're doing any kind of resistance, make sure that you don't dislodge that. These are all the things that you need to think of. So I know it's a lot of thinking, but if you're like Sherry right now, she doesn't have any of these issues with catheters or this kind of thing, but you might. So just watch out for that.
Let's talk about what exercise can't do. Exercise cannot cure cancer, and the same with diet. It is not going to cure cancer.
Yes, and there's so much out there about the keto diet, the paleo diet, juicing, running ultra marathons or whatever to starve the cancer cells. There's no proof that any of this cures cancer. Can it help? Yes, it is absolutely a critical part of it. Keto diet has been proven to help some forms of brain cancer. It has proven to lower the glucose load in your body. Exercise also, when you contract your muscle, every time you contract your muscle, it disposes glucose. That's glucose that the cancer cannot have. Your muscle will take first priority over that. So this is probably why exercise has been shown. That's why part of the reason that cancer patients live longer is because it keeps you metabolically healthy. At its core, cancer is a metabolic disease. The problem with that is that no matter how low carb you go, no matter how much exercise you do, cancer also feeds on amino acids, different amino acids that are in almost every food that you eat, especially high protein or any kind of protein. So there's no way to starve your cancer cells without also starving your good cells, right? Like you can't do that. It doesn't really work well. Now, this is a video for another day, but there is evidence, and there's good evidence, that doing keto and or fasting around chemotherapy is very effective. But that's a video for another day. It's again, but that's not a cure. That's a help. And there's different scientific reasons why fasting and or doing keto around your chemotherapy and exercising can be extremely helpful. It makes the cancer cells unstable and it makes your regular cells strong. And I believe that's probably why. But again, that's maybe something that we'll do another day. And Sherry and I have both done keto, and this is something that Sherry is going to tell you, and that especially with her kind of cancer and these targeted treatments, and the doctors, I don't think, take it as seriously, but they can cause weight gain. And there's a lot of people that are very unhappy with their weight gain. And the only way they can control that is by doing keto for a lot of people with cancer. And the doctors just don't seem to take it that seriously. Their job's to keep you alive. I don't think they care whether you weigh 120 pounds, 150 pounds, or 200 pounds. They're just happy that you're coming into your next appointment and your scans look good. But Sherry, I know, you've seen it, right? People like, I've gained like 40 pounds,
Right.
and they have to exercise and do something like a low carb diet, right?
Yeah, it's tough. I know if I'm not on the full dose of my medication. If I was, I think my weight gain would probably be a lot higher. But some of these people, yeah, they struggle so bad. It's not the drugs of the past anymore. I mean, where traditional chemotherapy, people struggle to keep weight on. Now we're struggling to keep weight off. It's tough. It's tough.
Yeah, and it's not something that doctors, they're not living it. And so I just don't think they take it seriously enough. Although I did see in your cancer group that one doctor did prescribe their patient, some lady that was talking, she said she's got this, the new Ozempic or Wegovy or the GLP-1. And so maybe some doctors are taking it more seriously now. But again, exercise, watching your carbs, these can help you maintain a healthy weight. And as we know, obesity is something that is a risk factor for other cancers. The last thing you want is to have one cancer and then get another cancer because of your treatment or your obesity. I mean, that's a real problem. Colon cancer, breast cancer is all tied to excess body fat. So we don't want that. I'm assuming you don't want that.
No, definitely not. Definitely not.
No. So once you have one cancer, you are more prone to get a second cancer. So it's so important to keep that under control. So let's wrap this up. Let's just talk about non-exercise activity. This isn't just a super important thing that you can do is outside of exercise, outside of going to the gym, we just live too much of a sedentary life. So if you can walk your dog, mow the lawn, walk further in the parking lot, take the stairs, all these things that you hear, it adds up to thousands of steps every day. I have a step counter. I think everybody should have one of these. You need to aim for 7,000 to 12,000 steps every single day if you can, whether that's walking with Leslie on the videotape or walking your dog or whatever. So these are just a few different things you can do. Ride your bike. Housework can be great, actually. Washing your car, playing games with your kids, gardening, joining online yoga, get on your treadmill, park your car, use the stairs. And another thing, one last tip I want to leave you with, because this is one that I just started doing. Walking or moving for 10 minutes after every single meal. Again, that seems like, well, why wouldn't I just walk 10 minutes anytime, right? Like get up in the morning, walk. I do that too. But moving your body for 7 to 10 minutes after every meal helps dispose that glucose quickly. I think there's no studies on this. Again, I cannot find any studies on that. This is just for everybody, cancer or not. But for cancer, people with cancer, I think it's so important not to have that excess glucose running around your system. If you could walk or ride your bike or swim for 7 to 10 minutes after every meal, you're going to see your metabolic health really be helped out. So I don't know if you do that, Sherry. I don't know if you've heard that, but that's the newest thing.
I haven't, but maybe it's something I will try.
Yeah, I mean, I just kind of sometimes just walk around my house. Like I just go in circles around my house. So I've started doing that a couple weeks ago. My last blood test, my glucose was almost high. It was like at 99, which is on the borderline of going over 100. So I've got to start doing something.
I mean, it's a really easy thing to do. 10 minutes is not that long. And yeah.
Okay. All right. So that is that. Please like and subscribe. We appreciate you. We would like to get to 1,000 subscribers. That's our goal. So if you appreciated this, hit the like button, hit the subscribe button, and we will see you next week.
See you next week.